welcome to Medical Dialogues Journal Club, your daily dose of health and medical news. I am Dr. Nandita Mohan and I am going to discuss about a rapid coronary bypass graft surgery study, the results of which has showed us that Ticagrelor can be discontinued 2 to 3 days prior to CABG procedure without increasing the bleeding risk. Ticagrelor is a more potent P2Y12 inhibitor which has shown to reduce major adverse cardiac events in acute coronary syndromes. It is increasingly used as a first-line therapy in ACS conditions. However, more potent P2Y12 inhibition has been associated with an increased tendency of bleeding. This may be of particular concern for patients with ACS who require coronary artery bypass surgery, abbreviated as the CABG procedure. In particular, the timing of cessation of Ticagrelor before proceeding to CABG is, however, unclear. Rapid titrate CABG is a randomized vanguard study to evaluate the feasibility and preliminary safety of a strategy of early versus delayed CABG in ACS patients initially treated with Ticagrelor and to identify potential mechanisms underlying the benefits or complications of early bypass surgery. According to this new randomized data that has been accumulated in patients with acute coronary syndrome, performing the coronary artery bypass grafting surgery, that is the CABG, is usually within a couple of days and after platelet medication cessation. For instance, the Ticagrelor cessation is considered non-inferior when compared to a waiting period of 5 or 6 days in terms of bleeding events. To prevent bleeding in such circumstances, the current US guidelines recommend waiting at least 5 days to perform the non-urgent CABG on patients with ACS who had been taking Ticagrelor, while European guidelines shorten this period to at least 3 days. All the guidelines are based on cohort studies with no randomized evidence. This trial is the first and only randomized study to evaluate the safety of early surgery. The rapid CABG randomized a population of 143 patients with a history of acute coronary syndrome to early CABG surgery or standard CABG. For inclusion in the analysis, patients needed at least to be 18 years of age and have undergone angiography for unstable angina. The results were presented at the AHA conference that discovered that there was no significant increase in bleeding when people had bypass surgery after 2 to 3 days of discontinuing Ticagrelor. This trial clearly shows that 2 to 3 days is not only safe but probably even effective, in that it seems to also reduce the ischemic events that can occur during the waiting period. Before, surgeons were basically going with 5 days, but now I'm sure they will be quite confident with shortening that period to 2 to 3 days. Now we have with us Dr. Prem Agarwal, a senior cardiologist at Sanjeevan Hospital, to give his comments on this topic.
Hello Nandita, I'm so thankful that you have raised a very important trial, and this is going to be a landmark trial changing the pattern of practice across the country. In fact, whenever the patient used to come with the acute coronary syndrome, and we used to load the patient always with the antiplatelets and especially Ticagrelor, and when after the angiogram it was found out that patient is having a TVD or is unsuitable for the PCI and should have been one for CABG, then the initiation of Ticagrelor was becoming a big problem because the patient had to wait for 5 to 7 days before the surgery could be taken for the fear of the bleeding. And this is a landmark trial where they have tried to use less than 3 days, that is 2 days to 3 days, and a surgery is done. And they have found out that with Ticagrelor, even the surgery can be contemplated very early without any risk of bleeding, extra risk of bleeding, as compared to that of waiting for 5 to 7 days. In fact, waiting for 5 to 7 days become a risk for the patient for ischemic events, and that is also further proved in this trial that the ischemic events will be higher if we wait for 5 to 7 days. And of course, all these patients are very sick, they are very bad diseases, and early revascularization would have been a very wanted procedure. But because of that initiation of Ticagrelor in the very beginning, many times it was delayed and leading to acute thrombotic issues. And I'm very happy that this particular trial proves that early intervention, even by surgery, is not dangerous. Thank you very much.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.